Roger Williams University is hosting a crisis management seminar on May 3rd at their Providence campus. Crises, whether a natural disaster, cyber attack, or financial instability, can have severe repercussions if not handled properly. This is where crisis management plays a pivotal role. Join Roger Williams MBA students and expert speakers to learn how to prepare for the unexpected. The program is totally free and open to the public. You can register online at rwu.edu/events/crisis-management-symposium.
This is the Bartholomew Town Podcast.
Inside Public Health is brought to you by CCA Health Rhode Island. Commonwealth Care Alliance, or CCA, is a multi-state integrated care system influencing innovative models of complex care nationwide. CCA's Uncommon Care model focuses on sustainable and evidence-based healthcare breakthroughs that improve the health and well-being of people with significant needs, and is consistently recognized as one of the best models in the country at identifying and serving traditionally hard-to-reach individuals. CCA is excited to bring Uncommon Care to Rhode Islanders with a range of Medicare Advantage plans. Learn more by visiting commonwealthcarealliance.org/Rhode Island. Okay, welcome back to another edition of Inside Public Health presented by CCA Health Rhode Island. We're joined today by Jennifer Samale, the Senior Director of Clinical Care Partnerships at CCA, and we're going to be talking about a few nutritional tips to help improve your overall health and well-being this summer. Welcome, Jen, and thanks for making the time.
Thanks for having us.
Nutrition is one aspect of health and well-being that is so critical, and I think a lot of people just overlook it. Perhaps there's been more attention than ever before, but it's something that culturally isn't always at the forefront of the conversation, and at the end of the day plays a huge role in outcomes. So it's a critical element of a well-rounded health and well-being. I was going to use the word diet, but I'll use any other word besides diet to describe what we're talking about today. But just the full package of health and well-being. So let's talk about nutrition. March was National Nutrition Month, and this is, of course, a subject that is a year-round, constant, important topic, especially important as we head into the warmer summer months that typically come with vacations, backyard barbecues, and any number of other fun events that can certainly impact a person's eating habits. I may even reintroduce the donut, which I have sadly removed from my own diet over the course of the last few months. I think summertime we'll see those pop back in on an occasional basis, we'll say. But why is nutrition such an important aspect of a person's overall health and well-being?
Well, paying attention to nutrition really comes down to thinking about what you're putting into your body day in, day out, week in, week out, year in, year out. We all obviously need to eat, and we all love food. So whether we're cooking a nice meal at home or going to our favorite restaurant, sitting down for a meal can really bring people together and is really one of our life's greatest joys. So all of that to say is that, when we talk about steps that we can take to improve nutrition, we're in no way saying that folks should immediately stop eating the food they love. We're really saying that we should just try to remember that our diets, for better or worse, really can be a core driver of our overall health and well-being. We know unhealthy diets can lead to serious, potentially life-threatening health complications and disease states such as diabetes, stroke, cancer, heart disease, and especially in older adults. So the choices that we make, starting even when we're young, are cumulative over our life and can increase that risk. Here in Rhode Island, local data shows that about 30% of adults and 33% of children ages 5 to 17 struggle with obesity. So not just being overweight, but actually being a little bit more than overweight and, hitting that obesity category. And obesity itself is a risk factor for disease states like diabetes and heart disease and cancer. So what are the main contributors to obesity? Essentially consuming more calories than your body needs and potentially not burning off those extra calories that you consume. So it's typically a combination of being careful about how much you're eating, what you're eating, but then also being active to sort of offset or balance if you do overconsume. Studies show that approximately half of American adults and more than half of American children do have poor quality diets. Not surprising. I think that we have so much available in our grocery stores. We have so many restaurants and fast food options out there. And oftentimes, we have a lot going on in our lives. We're challenged by, hectic schedules, racing to get to the bus, to school, to work, commutes, things like that. So we're going for the quicker, easier items. And when you think about a grocery store, typically a grocery store, the way it's designed is, on the outskirts of the grocery store, there may be healthier options. So, the produce tends to be on, when you enter, or on one side of the grocery store. And then in the center of the store is typically where you're going to find more of those, highly processed, more convenient foods. And so, just sort of thinking about, navigating that. And again, we're not talking about changing appearance. We're not talking about losing weight per se. It's about making small changes that will make a big difference in your health. So sustainable changes. I think if people overhaul their diet too quickly all at once, it's typically not something that they're going to sustain over a long period. So even, committing to one change this week or this month, like you said, taking donuts out or something like that. It's not to say you can never, have fun with a donut again, but, making a small change.
Yeah, it's so true. And it's helpful in any sort of self-improvement practice, whatever it may be, whether it's diet, exercise, mental health, sleep, whatever it is, to do it in an incremental manner, because, even if your goal is weight loss, that crash diet practice, sometimes people get into competitions where, it's like, all right, let's see who can reduce their BMI the quickest over a month period. And that is hardly sustainable for the most part. And unless you make those tweaks that really work for you and you can really commit to in the long term, it's not exactly a healthy practice in and of itself. At least, I have no medical expertise, but just from speaking with so many different people about this topic, that doesn't seem to be the way to go about things.
Absolutely. Absolutely. We want to make small changes that can be, sustained moving forward. And then we're going to have our, our slip ups, our setbacks, those types of things. But, you get back on the horse tomorrow, So, some simple ways to get started, on the right track. We talk about rethinking, food on the go, packing snacks, maybe packing our food for the day rather than hitting vending machines or running out at lunch to go to our favorite, restaurant or, fast food place. Typically restaurants and fast food, they want to satisfy the customer. So they are not really always thinking about how much salt, how much fat, how much flavor is added to something. That they want to please the customer. So those types of things are not being limited. They want to tantalize your taste buds. So, making healthier choices can start with packing food at home. So there's no denying that those faster processed foods are attractive. They offer a level of convenience, especially like we talked about when life is at its most hectic. But, eating those ultra processed foods does increase a person's risk for developing all cancers, and specifically like ovarian and brain cancers. So packing snacks from home, think about, cutting up some fresh, veggies, maybe pairing those with guacamole or hummus, put a little scoop in a container, bring it with you. Apple slices with peanut butter or like sun butter if you have a peanut allergy, a handful of mixed nuts. These are things that you can grab easily when you're on the run. They can minimize your reliance on these faster, less healthy options like the vending machine or fast food. Also thinking about meal prepping on the weekends. So, taking a little bit of time on the weekends, half hour, an hour, to throw something in the crock pot, make a pot of soup or stew or something like that so that you can bring it as a snack or a lunch or even a quick dinner, on those hectic hectic evening. So again, rather than relying on what's convenient, prepping ahead of time, to help carry you through some of that week more conveniently. And if folks need recipes, there's tons of recipes online. Nutrition.gov has some. There's, just endless recipes online that people can look at and get ideas. Frozen fruits and vegetables are another more cost-effective way to include these healthy foods. They're just as nutritious as fresh varieties. They're usually packaged at the peak of freshness. They keep longer without the risk of spoiling quickly, like fresh fruits and vegetables sometimes can. And then they're often pre-washed and prepped for ready to cook or eat. So that is a more and a cost-effective way and healthy way to introduce these foods. So you can add them to smoothies, add them to like your oatmeal. Sometimes what I'll do is I'll see our bananas are going bad on the counter, and I'll just peel them and throw them into a Ziploc or a container and put them into the freezer, or take that bag of spinach or kale that we haven't gotten to, throw it in the freezer. It's just being mindful of things like that. It gives you something easy to grab at another time.
We hear so much about processed foods. In fact, there was an article in the New York Times yesterday it was actually a quiz that you could take and kind of click through, and it proposed 3 or 4 different foods, and it said, guess which one's the most processed? And I think I got like 6 or 7 out of 10, and I'm kind of conscious of this. People don't realize, that there are specific ingredients to avoid, and also there are flags, if you will, red flags for when a food is particularly processed. Talk about that. Any specific ingredients folks should look out for if they're trying to improve their dietary routines?
Yes, absolutely. There are plenty, but to start, we can recommend keeping a closer eye on your intake of salt, fat, and sugar. So these things are sneaky. They find their way in, and they definitely add up. So in moderation, these ingredients can be part of a healthy, well-balanced diet, but they're also commonly overused and overconsumed. It's easy for a little extra salt, sugar, and fat to find their way in through foods like ketchup or other condiments, salad dressings, soups, like canned soups or jarred soups and bouillon, often great for flavoring, but, again, can sort of sneak in that extra, sodium and sometimes extra fat. Looking at seasonings and spices that contain sugar and salt. So I think about things like garlic salt or adobo. I mean, they're absolutely delicious, but they do sneak in potentially extra sodium and sugar. Health experts recommend limiting salt intake to no more than 1 teaspoon per day. So that would be a teaspoon that's spread across the entire day. And for people with certain conditions, that may even be too much. For folks who are healthier, they might get away with a little bit of extra. But a tip for folks who love extra seasoning, but want to be mindful of their salt consumption, try replacing some of the salt with alternatives, but still tasty options like garlic powder, onion powder, cumin, red pepper flakes, just different seasonings. I think about cilantro sometimes in a salad or something or lemon, squeezed over a salad can add a lot of extra flavor without adding, extra sugar or salt. Dietary guidelines for Americans recommends limiting saturated fat to less than 10% of your daily calories. So we all need fat. Our brains need fat to function. And certain nutrients, certain vitamins, we need fat in order to absorb them. So we do need fat, but we want to try to aim to consume most of our fat as healthy fat. So monounsaturated or healthy fats, which are commonly found in products like olive oil, sunflower oil, avocados, nuts like almonds, pistachios, walnuts. Those are considered healthy fats. Salmon or trout, I think of this season that we're coming into is, really common fishing season. So folks that are going to rivers or lakes to fish. And so trout, contains healthy fat. Salmon does. So we want these types of fats to be the bulk of what we're taking in for fat, and try to avoid unhealthy or saturated fats. Sometimes red meat can be high in saturated fats. Animal fats tend to be higher in saturated fats. Those are the fats that can clog arteries. So not to say they can't be included in a healthy diet, but we want to limit how much of those we're consuming. And then unhealthy trans fats found in fried foods and many processed foods. These are fats that they're changed. They're not a normal, naturally occurring fat, and they prolong the shelf life of these types of processed foods, like sometimes in like crackers or chips or like fried food. So we want to be careful of those as well. And then in terms of sugar, the American Heart Association recommends that men should consume no more than 9 teaspoons of added sugar per day, and for women to consume no more than 6 teaspoons per day. I'll be honest, even 1 can of soda can bring you up to or over that mark. So something to think about. Sugar really tends to sneak its way in through sugary drinks. So trying to switch over to drinks that don't have added sugar, or limiting, taking a cup of juice and cutting that in half, adding some water, or, swapping, soda for flavored seltzer. And then, going for potentially a dessert that's more natural or wholesome, switching to fresh fruit, yogurt. These types of small differences can really add up and make a big difference over time. So again, we want to start small. We want to, make a change that's sustainable. If you're drinking 2 sodas a day, cut back to 1, then aim to have it become more occasional over time. We want to make this sustainable for people. It's not really a diet. It's really about lifestyle, is what I'll say.
Yeah, it's the long game for sure. All right, let's talk about the trendy diets that seem to come up several times a year. You hear them, sometimes they advertise them on television, radio, whatever, and they sometimes purport to have a secret recipe for eating healthy. Is there such a thing as a secret recipe for eating healthy?
I think everyone's different. We all have different, cultural influences to how we eat, or taste bud preferences. I really don't think that there is an easy secret when it comes to nutrition. So despite what some of those, fad diets or infomercials that are talking about, like a miracle pill or a magic pill, or, typically, again, not sustained, something that temporarily may cause a tiny difference that ultimately is going to come undone in the long haul, and not always the best choice for health, and certainly not for sustainability. So the best way for people to improve their health is to try to make healthy choices, while remembering, again, like you said, it's the long game. It's a marathon. It's not a sprint. This is something that we have to do for a lifetime. So we're going to have hiccups. We're going to have, certainly, like you said, backyard barbecues or parties, have the piece of cake, you're going to have the barbecued meat, or, those types of things. So drink some extra water, take an extra walk. Tomorrow, aim to eat healthier or more whole, less processed. Nutrition is really an integral part of how we fuel our bodies and maintain our overall well-being. And I do think that we need to pay attention to how we feel after we eat certain things. Like, people can go into a bit of a slump or shake after they might have, pancakes with maple syrup. It's not to say you can't ever have those, but, they might feel a little crummy afterward, or after a big meal where we feel super sleepy, and 3 o'clock in the afternoon, we're wanting to take a nap at work, So, typically, if we're eating healthier, we're, aiming for more, fresh foods, less saturated fats, we just tend to feel more awake, alert, energetic. And certainly it's that feeling is influenced by how much we're also eating. So, not wanting to overeat and stuff ourselves. We want to be comfortably full. And especially older adults, they usually have lower calorie needs, but specific nutrition needs, like keeping the sugar down or keeping the sodium down. So it's making it even more important to pay attention to what is going into an elder's body. Consider your diet is a routine, not a sprint of deprivation or experiments. Certainly if you have questions or concerns about what your nutritional needs are, start with your primary care provider. If they're not able to offer guidance, and most of them usually can, but if not able to offer the specific guidance that you need, they can certainly suggest additional resources, or make a referral to like a dietitian or a nutritionist.
Somebody once told me over the last couple of months, a good thing to think about is the rule of two. And that's to say, if like you eat a plate of pancakes one day, don't eat it the next day. If you get off of your exercise routine one day, make sure you get back on it the next day. And I've been trying to practice that myself, and it seems like a kind of sustainable way of doing things. And I don't know. And another thing that we talked about offline is, you and I both are vegan, and there's so many of these alternative. In fact, it's a humongous booming industry is the alternative meat sector. You even find it in conventional fast food now. A lot of that stuff is highly processed. So if you're going that vegan, vegetarian, pescatarian route, you really have to think about things in a kind of unique manner in terms of what seems like healthy food may in fact really not be healthy.
Absolutely. I couldn't agree more. Oftentimes there's extra fat, there's extra salt, to make these things more appealing and flavorful, satisfying, that type of thing. And those are sneaky. I mean, every gram of fat has more calorie impact. A gram of fat is 9 calories. A gram of carbohydrates or protein is only 4. So, we do need to be, thinking about how much fat we're getting in, because even if we grab a handful of nuts in the morning and then we have, I'll think about some of those processed meat burgers. They can be high in fat, and then we have a salad with some salad dressing, that fat content over the day is really starting to sneak up. So even though we think we're making healthy choices, we really do need to, pause, think about it, be mindful of it. Those processed foods, often are sneaking in a lot of the things that we talked about today, the fats, the sugars, and the sodium.
Jen, thanks so much for your time and, great insight. CCA Health Rhode Island, uncommon care, including nutrition, no doubt about it.
Thanks for having me. It's great.
At HealthSource RI for Employers, we provide access to health insurance to more than 1,100 local businesses and nonprofits, and 96% of them renew through us every year. Maybe it's our choice of 19 different health plans, our 10 years of customizing solutions, or our one local team of dedicated experts helping employers find quality health insurance. See how our numbers stack up for you. Learn more at healthsourceri.com/employers.